Pain relieving injections don't fix any injury. They actually make it a lot worse. Hi everybody, I'm Dr. Matt Maggio. I'm the clinic director here at Peak Injury Solutions, where our mission is to make chronic injuries obsolete. In today's video, I wanted to talk about pain relieving injections and the actual risks that are associated with that. So when I start talking about pain relief injections, I'm talking about cortisone shots, epidurals, steroid injections, everything like that. So I wanted to go first into the idea of what makes a treatment something that's going to work. You know, it always runs through this idea. It has to be safe, it has to be effective, and it has to be durable. These are actually the criteria of the FDA. In order for them to approve any drug or treatment out there, they have to be safe, effective, and durable. So I wanted to take through each level of that. I'm gonna get a little nerdy on you, but this is something that's gonna really help get better informed decisions. So first off, are those injections safe? You can debate back and forth. You know, the manufacturers of those injections will say they're safe for sure. Yes, you can get an infection from them. You can get a reaction and things like that. Here's something that a lot of people actually don't know what happened. I think it was about 7 or 8 years ago, there was this batch of epidural injections that were out there. And what happened was the manufacturer cut some corners on that. And when they cut some corners, it didn't formulate correctly, and it actually grew some mold in there. And what happened was they were injecting people with these epidural injections, and it ended up killing these people. People got meningitis infections. People that were in their 20s, 30s ended up dying. I think when it was all said and done, there was at least 20 or more people that died. That's some crazy stuff when someone thinks about that. Next one, effective. Are these measures effective? Sure, they're really good at getting rid of pain. But the problem with pain is in there for a reason. It's letting us know that something is going on. Think of pain as your body's built-in check engine light. It's been around for millions of years in evolution. It lets us know that something's wrong. Now, the problem with a lot of these drugs are they're very effective at getting rid of pain, but they don't do anything to improve the function of what's going on. Last one, durable. What does durable mean? Is it long-lasting? No, these are not long-lasting at all. And people have to get multiple ones going forward because that pain comes back, causes bigger problems. Here's the other thing about injections. They actually make things worse. It's actually been shown and documented in studies that cortisone actually degenerates the bone, deteriorates the bone, and makes things worse. It sounds like a giant conspiracy theory to me. Now, let's go over what happens when you get one of these pain-relieving injections. So I drew out these fancy blocks in here. Down here would be no pain. If you have no pain, you're not in a doctor's office, you're feeling good, you're probably not watching this video. Now, up here, I drew this line. It's called symptom threshold. It's when your body actually experiences when you're having a problem. It's like your check engine light builds in. So one problem that comes in is your issue is a combination of a lot of things stacking up. One of those problems, and I put an X through there, is degeneration. A lot of times we see this with people that have a tear, cartilage damage, a disc injury, things like that, degeneration. Then what happens over time is those muscles in and around that area build up with all this stuff that's called glue. It's like scar tissue. It gets inside the muscle, makes it very weak and very inflexible. Those are that's the thing that we're actually experts at finding and fixing. And then when all this happens, you get that inflammation. And this pushes a person over threshold where it's like, ooh, this doesn't feel good. I'm feeling a lot of pain in there. So people end up at the doctor, they end up at the orthopedic doctor and they're like, I'm in a lot of pain. And the first thing they do is like, let's take your pain away. And everyone's like, yeah, that sounds great. I don't want to be in pain. Our job as humans is to avoid pain and go towards pleasure. But what happens when you get one of these injections, what it does is it actually raises up that threshold. Now you get a new threshold. So you're just not noticing it as much. These problems are still there. Now, yes, the cortisone shot will get rid of a little bit of inflammation, but the problem that people are running into is that degeneration is still there, that scar tissue is there, and that inflammation comes back. So people are getting repeated injections over time, and what it's doing is actually making that degeneration a lot worse. And the crazy part is it's allowing people to get justified for surgery on the back end. Pain relieving injections are a bad idea. They only make things worse. Now, I'll get people all the time that send messages and say, well, I got one and I'm great. That's awesome for you, but it didn't actually fix anything. The big take home here is ask questions. Do research. Don't let someone put something in your body that can cause problems without asking questions. And ask very carefully and cautiously and say, is this safe? Is this effective? Is this durable? Because if it's not, it's going to make things worse in the long term and really speed up that problem. So I know I was a little long-winded here, but really good information on here. And if you like this video, it resonated with you, or it's something that you want to share, send us a message, give us a comment, or even just reach out to us and ask directly. We're always here to help. Appreciate you watching the video, and thanks for stopping by, and we'll see you guys on the next one. Bye.